Greetings to attendees and distinguished guests of the Taiwan Patient Safety Forum. It is an honor to speak to you today, representing the National Patient Safety Foundation here in the United States. I extend my congratulations to you for your commitment to improving the safety of healthcare and for the important work you are doing as pioneers of patient safety in Taiwan. I want to especially thank Dr. Chen Liao Ming-Yi for organizing the forum, for hosting the Patient Safety Education Rally, and for inviting me to speak to you all today. Some of you listening today may not be familiar with the National Patient Safety Foundation, NPSF. Our foundation began as an idea proposed in 1996 at a large conference on medical error. Organizers of the meeting announced plans to form a foundation that would be a collaborative initiative involving all members of the healthcare community aimed at stimulating leadership, fostering awareness, and enhancing patient safety knowledge creation, dissemination, and implementation. In 1997, NPSF became an independent, not-for-profit organization. Today, the Foundation offers a wide variety of programs, all designed to advance our vision, creating a world where patients and those who care for them are free from harm. Since NPSF was established, we have seen significant progress in some areas of patient safety in the U.S. and certainly greater awareness, as you in Taiwan have seen. Although the U.S. and Taiwan healthcare systems differ in some ways, we face similar challenges. Unfortunately, one thing we do have in common is the fact that Taiwan's hospitals deal with many of the same medical error issues with which we in the U.S. still struggle. Medication errors, hospital-acquired infections, falls, and laboratory errors, to name just a few, still occur far too frequently. I am grateful for this opportunity to talk to you today, and I want to begin by talking briefly about some of our Foundation's primary areas of focus. First, worldwide, much of the work done to date in patient safety has focused on inpatient settings. In the U.S., as we acknowledge that the majority of healthcare today is provided in ambulatory settings, we have started to broaden our focus to encompass care throughout all settings. Innovative research into relatively new areas such as diagnostic error, communication errors during transitions of care, and failures to follow up on test results has shown us how much work remains to be done. Second, we are actively working to improve how we use health information technology, which I am sure is also a priority in Taiwan. Almost everyone today agrees that health information technology has the potential to improve safety. And almost everyone has heard a story of how health information technology can go wrong. Our challenge now is to ensure we are using information technology wisely with more effective implementation that helps reduce, not create, errors. Third, we at NPSF strongly believe that workforce safety is a patient safety issue. Healthcare workers in the U.S. suffer more harm than in many other high-risk industries. Physical harm in the form of needle sticks and musculoskeletal injuries, and psychological harm from disrespectful behavior and stress. We must ensure that healthcare workers feel safe physically, psychologically, and emotionally. Only then can they be 100% available to care for their patients and ensure the patient's safety. Focusing on the workforce also includes emphasis on patient safety education. One of the keys to transforming the safety of the healthcare system is to ingrain safety concepts into medical training in all of the health professions. One of our programs, the NPSF Lucian Leap Institute, was created to provide vision and strategic goals for the patient safety field. The Institute was an early proponent of reforming the medical education system to put greater emphasis on safety science, communication, systems thinking, and teamwork. We have seen some improvement in the form of continuing education requirements in patient safety and healthcare quality. We've seen strong growth in the use of simulation to help students learn clinical skills before attempting them on patients. And we are even using simulation to improve activities such as shared decision-making and apology and disclosure after a medical error. It is critical that those being trained in healthcare learn important skills such as professionalism, interpersonal skills and communication, provision of patient-centered care, and working in interdisciplinary teams. Education contributes to professionalism, and today, patient safety can rightly be considered a unique healthcare discipline. In 2012, NPSF created a patient safety certification program that establishes core standards for the field and sets an expected proficiency level for those seeking to become professionally certified in patient safety. Fourth, NPSF is a strong advocate of greater transparency in healthcare, which we define as the free, uninhibited flow of information that is open to the scrutiny of all others. At all levels of healthcare, between patients and clinicians, among clinicians, between organizations, and with the public, we can point to examples of how greater transparency helps to improve care and the patient's experience of care. Fifth, we and many in the U.S. are working to promote greater involvement of patients and families in their care. The patient is the only one who is present throughout all of his or her healthcare experience, and the evidence is mounting that patient and family engagement can contribute to safer care and better outcomes. Importantly, as the patient safety field has advanced in the U.S., one lesson has become abundantly clear. Nothing can take the place of a culture of safety. According to the U.S. Agency for Healthcare Research and Quality, a culture of safety includes a few key features. 1. Acknowledgement of the high-risk nature of an organization's activities and the determination to achieve consistently safe operations. 2. A blame-free environment where individuals are able to report errors or near misses without fear of reprimand or punishment. 3. Encouragement of collaboration across ranks and disciplines to seek solutions to patient safety problems. And 4. Commitment by an organization of resources to address safety concerns. The lesson is that the only way to create a safer health system is to ensure a culture of safety, rather than only focusing on specific safety issues. Regular assessment of an organization's perceived safety culture is recommended. As many of you know, results of safety culture surveys can be used as a starting point to create a plan for improvement. A related lesson has been the importance of leadership. I believe most leaders of healthcare organizations want to create a culture of safety. Not all know how to go about creating such a culture. We need to better educate our leaders about patient safety and the importance of culture, as well as develop tactics that leaders of organizations can use to promote a safety culture. And by leaders, I mean leaders at every level, as we know culture can differ even between units in the same organization. In closing, I want to emphasize that, as hard as this work may seem at times, it is incredibly important. No one working in healthcare goes to work with the thought of harming a patient. And when a patient is harmed, those professionals involved often suffer as a result. Our goal is to create organizations that never miss an opportunity to improve by learning from errors and taking steps to prevent them from happening again, and that have support systems in place for patients, families, and healthcare professionals that can help them heal when something does go wrong. Thank you very much for giving me this opportunity to address the Taiwan Patient Safety Forum. I wish you all the best in your important work.